Welcome to everybody. Welcome attendees back to the virtual transplant journey 2022. We are excited to recognize our sponsors who have made this event possible. Please give your attention to this short video presented by Trio National.
On behalf of Trio National, congratulations, Michelle and Marty Marin and your Trio Maryland chapter for putting together this fantastic conference adapted for the restrictions of pandemic year past. Great work. Anybody else would like to join Trio in making things like this happen? Go to our website at trioweb.org and sign up. You can make a big world of difference, just like Trio Maryland is with that kind of leadership.
Please remember, of course, that you can post your questions in the Q&A tab, and we will share with the speaker after the presentation as time allows. Now let me please welcome Dr. Seema Mehta Steinke, who is a clinical assistant professor in the Division of Infectious Diseases at the University of Pittsburgh Medical Center. Her clinical focus includes transplant and oncology infectious disease, providing infectious disease care for oncology patients, as well as solid organ and bone marrow transplant recipients, and providing telemedicine care to various patient populations across the country. Please welcome Dr. Steinke.
Hi, thank you for having me. So my talk today is on strategies for safer living after transplantation. The objectives for today's talk are to understand what infectious risks exist after transplant, to identify measures that can be taken to prevent infectious risks, to recall COVID-19 guidance for safer living. And now that we have monkeypox, I included a section to describe monkeypox and summarize guidance on prevention, especially for solid organ transplant recipients. So infections and the risk to a solid organ transplant recipient. So infection remains a risk to SOT recipients long after the initial post-transplant period. What factors affect risk? Well, that includes our patient's net state of immunosuppression, which I will explain in just a few moments here, what exposures you have, and consequences of the invasive procedures the SOT recipient may have undergone. Where do infections come from? They can be due to organisms within the body, such as endogenous organisms is what we call them. An example of this would be CMV or cytomegalovirus. It can also be due to donor-derived infections and can be due to environmental exposures. This talk today is going to focus primarily upon environmental exposures. So it's ultimately a balancing act between your graft survival or the survival of your organ that's been transplanted and your quality of life. So a major goal of transplantation is to be able to lead as healthy and normal of a life as possible. Risk of exposure to infectious agents will always be present, and a solid organ transplant recipient should be counseled by their care team on ways to minimize the risk of infection. Strategies for safe living must be incorporated into a solid organ transplant recipient's life as they move toward regaining normal function and returning to an active and productive life. So the net state of immunosuppression is what we kind of describe where a patient lives with regards to their state of immune suppression. So as you can see here, the green line shows what functioning a normal immune system would be at. So let's say it's functioning at 100%. And if you get immune suppression due to an organ transplant, for example, you might drop down to 20% of immune system functioning due to the immunosuppressive medications that you may be receiving. So you may go along at around 20% or so for the first 6 to 12 months. In this example, we kept it going until about 7 months. And then after that, your immune system improves just a little bit, maybe to like 35% or so. And you may continue on that for a short period of time, and then it'll improve a little bit more, let's say to about 50%. And all of this is with fine-tuning of your immune suppressive regimen, and oftentimes even backing off a little bit on the immune suppressive drugs to give you the lowest effective possible dose. But in doing so, we often run into bouts of rejection. And when you have a bout of rejection, you get increased or intensified immune suppression, and that may drop you right back down to 20% again, right where you were when you first got your transplant. So where you fall on this purple line in this graph is essentially what we call your net state of immune suppression. So how immune suppressed are you at that moment in time? And we look at it over a trajectory. So were you just transplanted? Are you in the first 6 to 12 months? Then you're probably at your lowest state of immune suppression. Are you further out, let's say a year or two out, then you may be more like 50% or 60% of your immune function being normal. And if you haven't had any bouts of rejection, then you may remain at that level for an extended period of time. So this is your net state of immune suppression, and this tells us how likely you are to acquire infectious complications during your course. So what are some environmental exposures that we can consider? So there's occupational exposures, recreational exposures, travel, exposure to people, exposure to animals, and exposure to water and food. And as time goes on, it's really easy to become relaxed in the restrictions and measures that we take to try and prevent infectious complications, and that's normal. So what do we do when we assess the risks? So we need to understand your risk as your care team. So we will ask a lot of questions to include: where do you live? Where were you born? What travel have you done, both recent and remote? We may ask things like, have you ever traveled to Southeast Asia in your entire lifetime? So we get very specific, and we want to know everything that you've been exposed to over the course of your life. What pets, animals, or bird contact do you have? What is your occupation? What are your hobbies? What are your lifestyle habits? And what are your food and water exposures? And lastly, do you have any sick contacts on a regular basis, or are you in situations that increase your chances for having sick contacts? So moving to the question of where do you live, where were you born, where have you traveled, this is ultimately to get at the fact that different parts of the world have different infectious risks. So even down to different parts of the United States, if you are from the southwest part of the US, you have a different risk factor for a specific type of fungal infection compared to that if you were living in the Ohio River Valley area. So it really depends on where you're from and how long you lived there, and have you traveled back there, and then also travel just to other places for fun, for leisure. That all will tell us what kinds of things you may have been exposed to over your lifetime that you could be at risk for having become an issue after transplantation. So we kind of briefly talked about where you live, where you were born, and your travel history. Let's move on to pets and animal contact. So let's go through some true or false questions. Dogs are safer than cats when it comes to infection transmission. The answer to that is true, but only to an extent. Dogs and cats can both transmit infection. Dogs do so just a little bit less than cats, but both can still transmit infection. True or false, it's okay to pet stray animals. The answer to that would be false. Stray animals can be riddled with any number of infectious agents that can be transmitted to humans. So it's always important that you keep your distance from stray animals and try to avoid touching them if at all possible. True or false, reptiles like snakes, iguanas, lizards, etc., do not transmit infection. This is actually false. There's actually lots of reptiles that can transmit infections, such as salmonella. So it's something that you need to be aware of when you go to a pet store, or when you're with your children or grandchildren and they want a pet reptile, something to keep in mind. So what are some other animal-related infections that we consider? So cat scratches can lead to an infection called cat scratch disease, which is from an agent called Bartonella, a bacteria. Cat litter can lead to toxoplasmosis. Reptiles, as I've mentioned, can lead to salmonella. Monkeys can lead to herpes B virus, which is a type of herpes infection. Chickens can cause fungal infections known as histoplasmosis and another one called cryptococcus. Birds can transmit a bacteria called chlamydophila, which can cause a pneumonia. Aquariums, specifically cleaning fish aquariums, can lead to an infection called Mycobacterium marinum, which can infect the skin. It can also go to other areas of the body, but primarily as a skin infection. Mosquitoes can transmit West Nile virus, Zika, chikungunya, dengue virus, all viruses that we need to be aware of. Rodents can transmit lymphocytic choriomeningitis virus, which is another type of virus that can cause a meningitis. And puppies, kittens, and chicks can all transmit Campylobacter, which is a bacteria that can cause severe diarrheal illness. So what are some key points when it comes to pets and animals? Do not get a new pet in the first year of transplant or during times of increased immunosuppression. So for example, if you've had a bout of rejection and you end up getting more immune suppression to treat that rejection, it's best not to get a pet in that time frame. Avoid sick animals, for example, an animal with diarrhea. Avoid kitty litter, cleaning bird cages, bird feeders, and handling animal feces. If you have to do these and it's unavoidable, use disposable gloves and a surgical mask. Avoid live vaccines in animals when effective non-live vaccines exist. A good example of this is the kennel cough vaccine. There is one that can be intranasal or orally given, but that is a live vaccine. There is one that's less commonly offered, which is an injectable one, which is a non-live vaccine. The reason being is that when it's given as a live vaccine to the animal, they actually shed the bacteria that causes kennel cough, and that can be transmitted to humans. There's case reports of this happening in lung transplant recipients, actually, and it can be fatal. So it's really important that you collaborate with your vet to work on avoiding live vaccines in your animals when it's possible and safe to do so. And when it's not possible, it's best to avoid that animal for a period of about 2 to 4 weeks after receiving that live vaccine. And avoiding would include things like petting, kissing, licking, any of those interactions that you have with the animal. And that would also include avoiding picking up animal feces or handling any of that. So it'll just require some avoidance and some strict measures on your part, but it is feasible to collaborate with your vet and have appropriate vaccines given to your animal. You should take the pet regularly to the vet for checkups. Avoid stray animals, as I mentioned earlier. Avoid contact with non-human primates, for example, monkeys, as they do carry their own set of infectious risks. Ensure that areas near the home are free of raccoon latrines. This is, again, because there's lots of infectious risks associated with raccoon feces and whatnot, and inhaling that area can lead to certain infections. Wear gloves to clean aquariums or have someone else do this. And the gloves you use should be thick, not just latex gloves, but something that could avoid cuts on your hands or your arms while cleaning the tank. And seek care if an animal bite or scratch occurs. It's really important you do so as quickly as possible. Cleaning it out by a healthcare professional and receiving antibiotics early on can really prevent serious infectious complications that can arise from animal bites and scratches. And you should wash hands after handling pets or any of the pet maintenance, such as handling their feces or litter or whatever. Avoid mosquito bites if possible, so use DEET. There are natural products out there, but they're just not as effective as DEET. And I'm not one who usually promotes use of chemicals that may not be good for you, but in this instance, DEET is actually the best way to prevent mosquito bites. And so it's really beneficial to use that when you need to. And ultimately, it comes down to hand hygiene and maintaining pet health. These are vital measures that you can take to prevent infectious complications. So pets are okay to have. Despite the risk of infection from animals, there are many benefits to owning pets, and it has been demonstrated that solid organ transplant recipients have often had family pets without any transmission of infection. The psychological benefits of pet ownership must be weighed against the potential risks for transmission of infection. In one study of 89 lung transplant recipients, including 52% who were pet owners, reported a significant increase in various metrics measuring life satisfaction among pet owners without any increased risk of hospitalization. 96% of the pets were obtained pre-transplant, and 91% of those were indoor pets. So it is okay to have, it's just important that you take the necessary measures to protect yourself. So what happens if you work with animals? So those who work with animals should, if possible, avoid working during periods of intensified immunosuppression, so right after transplant and after bouts of rejection. And when returning to work, a transplant recipient should minimize their exposure to potential infections by using proper precautions, including frequent hand hygiene and the use of gloves and masks when indicated. So let's move on from animals to occupation. So what are some pre-transplant occupations of transplant recipients that we've seen? We've seen professional horticulturalists, we've seen infectious disease, general surgery, or ICU doctors. We've seen dentists, an ICU nurse, criminal justice system workers, plant pathology laboratory worker, farmers, gardeners, landscapers, construction workers, child care teacher and special education provider, pet store employee. So all of these have some sort of infectious risks associated with them. So what are some important questions that we may ask you? What kinds of activities does your job involve? Are you concerned about the risk of infection in your workplace? And if so, are there job modifications that you could make to make that safer? Do your supervisors and coworkers know about you having had a transplant, and are they understanding and supportive? These are all things that are helpful to not only ask yourself, but ones that your care team will likely ask you as well to ascertain your risks and to understand what we're working with in order to improve your situation if there are infectious risks present. So what are some ways to make the workplace safer? You can avoid TB exposures. So if you are someone who works in the community, avoiding shelters or nursing homes, or if you're a lawyer, avoiding jails or prisons and immigration offices. Wear gloves when handling soil or dirt. Wear masks or respirators when fungal spores may be aerosolized. So in other words, if you're working in an area where dust is being aerosolized, or you're working with mulch and you're laying mulch, or you're putting down dirt. This includes home renovations. It's prudent for transplant recipients to avoid exposures to home renovations, especially after early after transplant or after rejection treatment, or any time after a lung transplantation. And that's because there are so many fungal spores that can be in that environment that you can inhale and lead to all kinds of fungal pneumonias, some of which can be very difficult to treat. Avoid exposure to animal feces, including bird feces. So avoid chicken coops. So if it's necessary to clean out a chicken coop, get the help of someone else to do that. It's best to avoid it if you are a transplant recipient. And meticulous hand hygiene in all situations is important, even if gloves have been worn. Wear a mask or respirator if exposures to the above is unavoidable. And use common sense. If it feels unsafe, it probably is, and it's probably a situation that you should avoid or work around so that you can avoid it or minimize your exposure to it as much as possible. So what about if you're a transplant recipient and you work in healthcare? So you should avoid urgent care, general pediatrics, and ER settings if possible. And if you can't, use a mask frequently or at most times. And also you wear gloves and practice hand hygiene frequently. Update all indicated allowable vaccines. Observe precautions. In other words, we oftentimes will have signage posted outside of patient rooms indicating if a gown or gloves or things of that nature need to be worn when entering that room. And if so, then it's necessary that you observe those precautions, abide by them, and make sure that you are adhering to them as best as you can. And if you are cytomegalovirus or CMV, or VZV, which is the chickenpox or shingles virus, if you've never been exposed to those, in other words, if you are negative for them, you should avoid contact with patients that have those infections, and you should follow special instructions provided by your healthcare team. So let's move on from occupation and talk a little bit about hobbies. So what are some hobbies and the associated infections and risks that they have? So gardening or laying mulch can lead to aspergillus or other fungal or mold infections. So you should use gloves and a mask and avoid being in a garden barefoot. Carpentry can also lead to fungal infections, including one called histoplasmosis. So if practicing carpentry, it's important to use a mask or a respirator, such as a KN95 or N95 mask when doing so. If you're hunting, make sure that you avoid field dressings and don't drink the water, and you should cook meat thoroughly, as trichinosis and cryptosporidium are infections that we often see associated with hunting. Fishing or scuba diving can lead to mycobacterium infections, Vibrio infections, or cryptosporidium. So the big thing is to try and avoid injury while in the water, and don't drink the water. And then spelunking can lead to cryptococcus or histoplasmosis, and so it's essential that you wear a mask and gloves. And lastly, contact sports. So football, rugby, soccer, any of those sports should be avoided if possible, because you can result in injury to the graft or the organ, especially if you're a kidney transplant recipient, as that is very superficially placed in the abdomen. So it can seriously be injured if you participate in contact sports. So it's important to avoid that. And if any of these activities are pursued or other hobbies, hands should be washed after activities, even if gloves are worn. So let's move on to habits. So recreational drug use, for example, marijuana, smoking, or vaping can lead to fungal infections. And if you are going to participate in using marijuana, we don't discourage it per se. We just say don't smoke it or vape it, consume it by eating. That's actually preferred, as it is less likely to lead to fungal infections. Avoid things like LSD, meth, cocaine, heroin, etc. All of these can be laced with unknown substances, and that can interact with your transplant medications or just cause other problems, including infections, depending on what the substances may be laced with. And so it's important to avoid those. And then prescription narcotics should only be given and taken when prescribed by your physician. Do not take ones illegally obtained, as sometimes there are drug-drug interactions that need to be accounted for with your transplant medications. So it's important that only your physician who manages your transplant meds are the ones prescribing the narcotics if you need them, so that they can monitor and manage any interactions that may arise. So safe sexual practices is also important. Use latex condoms outside of monogamous relationships. Consider the use of condoms during sexual activity, even with a long-term partner, but during periods of increased immunosuppression. So after transplantation or during bouts of rejection that's being treated with increased immune suppression. Avoid exposure to feces. Vaccinate against hepatitis B and human papillomavirus, or HPV, when appropriate to do so. And the goal from all of this is to reduce sexually transmitted infections, including hepatitis B, hepatitis C, HIV, cytomegalovirus or CMV, human papillomavirus or HPV, and herpes. What about tattoos and body piercings? So these actually represent a break in the skin, which can lead to infection. And these are not encouraged activities. If body piercing or tattoos are to be obtained post-transplant, then these should be obtained at reputable centers with good sterile technique. And self-piercing or self-tattooing or sharing of needles should all be avoided, as those are all higher risks for infectious complications. So let's move on a little bit to water and food exposure. So it's important to avoid unpasteurized products such as juices, dairy, cider, cheeses. Cheeses to include things like brie, feta, blue cheese, goat cheese, moldy cheeses, any of the soft cheeses really. You should check labeling on them to ensure that they have been pasteurized. And the reason to do so is unpasteurized products often contain things like E. coli, salmonella, listeria, cryptosporidium, yersinia, and brucella, all of which can cause serious infection and illness in transplant recipients. Avoid raw or undercooked eggs. This includes uncooked cake or cookie batter, some preparations of Caesar salad dressing, mayonnaise, or hollandaise sauce, as all of these can include salmonella. Avoid raw or undercooked meat, poultry, or fish, as you can have bacterial and parasitic infections such as tapeworms come from that. Avoid raw or undercooked seafood, as bacterial, viral, and parasitic infections can all come from undercooked or raw seafood. Avoid ingesting raw seed sprout, so alfalfa or mung beans. They can also be riddled with all kinds of infections, including salmonella and listeria. Avoid cross-contamination during food preparation. So if you are preparing meat or eggs, make sure you wipe down your surface, wash your hands, clean the knife or the utensils you were using, the cutting board, etc., to avoid getting any potential infectious agents such as salmonella or listeria or E. coli transmitting from the raw meat or eggs to things like your vegetables. Avoid uncooked pate, meat spreads, cold cuts, and smoked seafood. Reason being is that they are not cooked to a temperature that is sufficient to kill off most bacteria and other parasites. Cold cuts in particular, they sit out in the deli counter, and although they may be in a refrigerated case, it's not always the most hygienic situation, and cold cuts from the deli counter are often frowned upon. Cold cuts that you can get pre-packaged, like factory sealed in the refrigerated section, that is safer if you are someone who enjoys cold cuts than getting it from the deli counter. And then wash all fruits and vegetables, even if it's labeled as pre-washed. So that includes your quote unquote triple washed spinach or lettuce. Wash all of it. It is important because we still have outbreaks of things like E. coli, despite having pre-washed fruits and vegetables. Avoid eating at public salad bars, buffets, street vendors, and picnics, especially when food has been sitting out at room temperature for an unknown period of time. And avoid potluck meals where hygiene standards of all participants are not necessarily known. And then avoid eating food prepared by someone with a recent diarrheal illness. I know that may be some information that most people won't share with others, but if you catch word that there's any potential recent illness of any sort, whether it's diarrheal or respiratory, it's probably best to avoid eating food prepared by that person. Let's move on to water exposures. So waterborne infections most often occur due to consumption of contaminated water or inadvertent water ingestion during recreational activities. Cryptosporidium can cause a severe chronic diarrheal disease. It's resistant to chlorine, and it can rarely be found in treated water sources. So to eliminate all risk, you should bring water to a rolling boil for at least 1 minute or 3 minutes if you're at elevations greater than 6,500 feet, or utilize personal filters or consume bottled water. So if you're not in an area where you know the water has been well treated, it is best to avoid drinking the water directly. It's better to either boil or use a filter or just have bottled water. And then of course, keep in mind that ice and fountain beverages may be made from untreated water. And this is really important when traveling overseas, as you know, untreated water in overseas locations, especially in developing countries, can oftentimes be very unsafe and be riddled with all kinds of bacteria and parasites. So it's important that you avoid ice and fountain beverages, especially when traveling. So let's talk a bit about water filters and bottled water. So water filters should have an absolute pore size of less than 1 micron, or should be tested and certified to NSF or ANSI standards 053. So I've included a link here that discusses this in more detail. There's quite a bit of information out there about this. And it is really important that if you are concerned about if you go camping or hunting or whatever, and you use a personal water filter, it's important that you are aware of the information that's out there that is necessary to have a water filter of a certain standard in order to ensure your safety. And then bottled water information can be obtained from the International Bottled Water Association. And I've included a phone number as well as a website here. And they go into a significant amount of detail about bottled water and what kind of water you should be looking for. And then the CDC also has information devoted to bottled water technology as it relates to Cryptosporidium specifically, which is a parasitic infection. And so I've left the link here for that as well. That's actually a really helpful resource if you have time to take a look at it. But for the interest of time, I was unable to go into all of these details. So what are some pearls of wisdom when it comes to water exposure? Public or private well water, especially in areas that are not screened frequently for bacteria, should be avoided if possible. If used, it should be tested yearly for microbial contamination. And it's safer to boil well water or use bottled water for drinking and brushing teeth. Do not drink directly from lakes, rivers, ponds, streams, etc. Avoid swimming in water that is likely to be contaminated with human or animal waste. Avoid swallowing water during swimming. To avoid spread of infection to others solid organ transplant recipients who have had diarrheal illnesses, should avoid using public recreational water facilities until 2 weeks after symptom resolution. You can oftentimes be shedding the bacteria or the parasite or the virus that was causing the diarrheal illness for a couple weeks after your symptoms have completely resolved. And so you are at the potential to infect other people with that infection if you were to go swimming, let's say, in a public or community pool. So it's important to avoid that. Hot tubs should be avoided. And that's because not only is the steam that is emitted from the hot tub containing different bacteria, but the water itself can lead to bacteria infecting particularly hair follicles. And so it can also lead to an infection of the skin. So hot tubs in general should just be avoided if it's at all possible. Standing water in the home or basement, for example, in a flooding situation, should be promptly cleaned to avoid growth of mold. And this should not be done by the solid organ transplant recipient. If it is absolutely unavoidable and the recipient must do this, it is important to wear gloves and use a mask during that cleaning process. When traveling to countries with poor sanitation, one should avoid drinking tap water and inadvertently consuming ice cubes or water while brushing teeth or showering. And if an abrasion or cut occurs while bathing in the ocean or fresh water, it should be immediately and thoroughly cleaned with an uncontaminated water source. Okay, now let's move on to sick contacts. And this is where we'll talk about a lot of different things, including flu, COVID, and now monkeypox as well. So when it comes to sick contacts, it's important to avoid, if at all possible, avoid crowded areas, avoid those who are sick, and avoid tobacco smoke. Wear a mask, and use hand hygiene. So let's talk briefly about diarrheal illnesses, as this is included in sick contacts. Cleaning and disinfecting surfaces in the home is important. So some causes of diarrheal illnesses, such as C. difficile and norovirus, are actually resistant to commonly used cleaning or disinfecting products. So bleach needs to be used in these particular scenarios. So if anyone in the home has a diarrheal illness, it's probably safest to be cleaning with a bleach product, especially in the kitchen and in the bathroom, to ensure that, you know, the surfaces have been disinfected of those infectious agents. So again, if someone in the home has a diarrheal illness, whether it is the transplant recipient or a household contact, rubber or disposable gloves and a bleach-based cleaner should be used on environmental surfaces to clean and disinfect, especially in the bathroom and the kitchen, as I've mentioned. And also, in the interest of time, I would have loved to have shown you this video, but the CDC does have a video on how to clean up after vomiting and diarrhea from a person with norovirus infection. And this is actually a really helpful video, and it's useful to watch, especially if you are in a situation where someone in the household does have a vomiting or diarrheal illness, some sort of GI infection. It doesn't have to be norovirus. You can use these measures that they discuss in this video to really clean after any vomiting or diarrheal illness. So it's actually a really helpful video. Let's move on to flu and other vaccine preventable illnesses. So close contacts of transplant recipients can transmit infections that can be particularly harmful to the transplant recipient. So vaccination against flu and other diseases like measles, mumps, rubella, varicella or chickenpox / shingles, or Tdap, which is the tetanus, diphtheria, and pertussis vaccine, which specifically treats or prevents tetanus as well as whooping cough. So it's encouraged that everyone in contact with, particularly those involved in the care of transplant recipients, be vaccinated against these entities. All household contacts should be instructed on good hand hygiene. So hand washing, also good cough and sneezing etiquette, and appropriate covering of open wounds. You should also receive yearly flu vaccine and ensure all other standard immunizations are up to date. And contacts at work or school should also be encouraged to receive their vaccinations. And this is particularly for people who are around a select group of people fairly often throughout their day. Those people should also be encouraged to be fully vaccinated in order to protect the transplant recipient. So let's move into COVID-19 guidance. So as per the American Society of Transplantation, it is important to get vaccinated. They recommend vaccination against COVID-19 and against flu for all transplant recipients. You should also wash your hands frequently with soap and water for at least 20 seconds, or hand sanitize with at least a 60% alcohol contact sanitizer solution. Avoid touching your face, eyes, mouth, nose. Avoid large crowds. Wear a well-fitting mask if you're going to be in a crowded space indoor. And practice social distancing. Stay at home if you are sick. And ensure household contacts avoid high-risk situations as well, and receive all standard vaccinations, including the flu vaccine and the COVID-19 vaccine. And it's important that transplant recipients continue safety measures, even if they are COVID vaccinated, especially until more is known about how to protect transplant recipients better, and how protective the vaccine actually is for transplant recipients. So we are still working on all of that. And it's evolving daily. That information comes out new every day. But it is important that until we have a better way to protect transplant recipients, that even if you're vaccinated, to abide by all the safety measures that we've been practicing since the beginning of this pandemic. The CDC has changed its guidance about masks when indoors for fully vaccinated people. However, the American Transplant Society and other transplantation societies around the world still recommend that transplant recipients should continue to wear well-fitting masks, including surgical masks, KN95s or N95s when indoors surrounded by other people, even if you're vaccinated. Wear a face mask if you're wearing a face shield, So oftentimes we see people wear a face shield that doesn't really do too much in terms of protecting them from respiratory droplets. So even if you're wearing a face shield, it's important to wear a face mask in addition to that. You can resume domestic travel, but continue to wear face masks on all public transportation, even if others are not wearing one. And it's important to monitor for case increases at your destination. And if there is a rise, avoid traveling to that area. It is safe to return to work, but continue to practice all of these safety measures as well. So again, wear masks, practice hand hygiene, practice social distancing. So what about the vaccine and transplant recipients in particular? So it is strongly recommended that all transplant patients receive the COVID-19 vaccines. You can receive the mRNA, which is Pfizer or Moderna, or the adenovirus vector, which is the Johnson & Johnson vaccine. mRNA vaccines are preferred as they are more effective in transplant recipients, and we're seeing that with more and more data that's coming out. It is important that you receive 3 doses of the Pfizer or Moderna, or 2 doses, one of the J&J followed by either Pfizer or Moderna. So after those, you should also receive a booster dose 2 to 3 months later. So if you're getting Pfizer or Moderna for all of your vaccines, you should receive a total of 4 doses up until the most recent guidance, which I will get to in a moment. So you should have received a total of 4 doses. If you received J&J as your first dose, then you should have received a total of 3 doses. So as I mentioned, the newest information has come out that there is a new vaccine booster that includes Omicron variants. And on August 31st, the FDA approved the Pfizer vaccine for ages 12 and up and Moderna for ages 18 and up. On September 1st, the CDC released a statement endorsing the newest vaccine booster. They stated that the updated COVID-19 boosters are formulated to better protect against the most recently circulating COVID-19 variant. They can help restore protection that has waned since previous vaccination and were designed to provide broader protection against newer variants. This recommendation followed a comprehensive scientific evaluation and robust scientific discussion. If you are eligible, there is no bad time to get your COVID-19 booster, and I strongly encourage you receive it. And that is it from Dr. Rochelle Walensky, the CDC director. So you should be at least 2 months since having received your last COVID shot, either booster or initial vaccine, before you can receive the newest vaccine booster. Some suggest waiting 4 months is best. I would say anywhere in that time frame is fine, but you should get that vaccine sooner rather than later. And if you recently had COVID, then you should wait at least 3 months from the time you had COVID before you receive any COVID vaccines. So let's talk briefly about Evusheld, which I'm sure many of you are aware of. This is a monoclonal antibody that contains antibodies that help prevent COVID-19 infection. It's used to prevent COVID-19 in immunocompromised persons that may not have responded well to the vaccine. It's okay for patients ages 12 and up to receive, and you have to be at least 88 pounds to receive it. It is not treatment for COVID-19, and it is not a substitute for vaccination. So it's administered as an intramuscular injection. The side effects can include an allergic reaction, which is rather rare, injection site pain, redness or itching, or injection site hematoma, which is essentially a bruising at the injection site. And it provides protection for up to 6 months after it's been given, but it may not last as long in all individuals. And it may not be as effective against future variants. The recommended dose is 600 milligrams. And if you are someone who received 300 milligrams earlier on, you will get called back to receive a second 300 milligram dose. The change in dosage came out as more data was coming out and describing that the 600 milligram dose was more effective. So that is why some people in the initial period when we were giving Evusheld received a 300 milligram dose, and those people are being called back for a second one. You can get it if you've had COVID-19 infection, so it is okay to get Evusheld. And you need at least 2 doses of the vaccine before getting Evusheld. And you still need to practice all safety measures as breakthrough infections have been reported. Let's shift away from COVID briefly and talk about monkeypox very quickly. So prior to April 2022, it was rare to encounter human cases of monkeypox virus infection outside of African regions where it is endemic. Monkeypox is a zoonotic viral infection. In other words, it's a viral infection transmitted from animals to humans, and it's related to the virus that causes smallpox. First human case was described in 1970 in the Democratic Republic of Congo. Sporadic human cases have been reported in Africa, typically originating from contact with wildlife reservoirs, particularly rodents. Human-to-human transmission was previously thought to be inefficient or not something that happens that often. But this spring, several cases began popping up all over the world. The WHO declared it an evolving threat of moderate public health concern on June 23, 2022. Transmission occurs through large respiratory droplets during prolonged face-to-face contact. This is along the order of hours, and it is a rare form of transmission. The more common form of transmission is with close or direct contact with skin lesions and possibly through contaminated surfaces. Vertical transmission, or transmission from a mother to an infant in the uterus, has been described. People can get it from infected animals, either by being scratched or bitten, or by preparing or eating meat or using products from an infected animal. And as of September 8th, the US had 21,504 cases, and California and New York have the highest case rates. And there's a link here that takes you to a map that tells you the most up-to-date number of cases in the US. The rash is often present, but not always, and it's usually preceded by prodromal symptoms, such as fever, swollen lymph nodes, flu-like symptoms, and some people have these symptoms after the rash, and others only have a rash. So it has a variable presentation, so you have to have a high suspicion of concern in order to really be thinking about this. Rash appears as a firm pimple-like lesion, but often starts in the genital or perianal areas and sometimes remain in that area or can spread to the rest of the body. It's contagious once symptoms begin. So if you have the presentation where you have fever, swollen lymph nodes, or flu-like symptoms before the rash starts, you're contagious when you first have that fever or flu-like symptom. You remain contagious until all lesions form scabs and the scabs fall off and a fresh layer of skin forms. And symptoms begin within 3 weeks of exposure and usually develop a rash 1 to 4 days later. And the illness in total typically lasts 2 to 4 weeks. So here's just some pictures from a recent New England Journal of Medicine article showing the skin lesions. You can see here the nose, the face, the mouth, all kinds of areas, the hands, forehead. These lesions evolve from a pimple-like lesion to form more of an ulcer, and then it scabs over, and then new skin forms when that scab falls off. So how can we prevent it? So data suggests that gay, bisexual, and other men who have sex with men make up the majority of cases in the current outbreak. However, anyone, regardless of sexual orientation or gender identity, who has been in close personal contact with someone who has monkeypox is at risk. How to protect yourself. So avoid close skin-to-skin contact with people who have had a rash that looks like monkeypox. Avoid contact with objects and materials that a person with monkeypox has used. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. It is possible that people who are infected can spread this to animals through close contact, including petting, cuddling, hugging, kissing, licking, sharing sleeping areas, and sharing food. So what about monkeypox and transplant recipients? At this time, we are still gathering data on monkeypox cases in transplant recipients. We have a large registry that is multi-center at this time, where multiple areas throughout the country are inputting data into this registry of transplant recipients who develop monkeypox in order to gather this information, monitor these patients going forward, and see what happens. We do know that people with immunocompromised states or pregnancy are at higher risk for severe infection and worse outcomes. Prevention will be key at protecting solid organ transplant recipients. So what about vaccination? There are 2 available vaccines in the US, the Jynneos and the ACAM 2000. The second one is not recommended for people with weakened immune systems as it is a live vaccine. So who should get vaccinated? If you've been identified as a close contact of someone with monkeypox, then you should get vaccinated. If you learn that one of your sex partners in the past 2 weeks has been diagnosed with monkeypox, you should get vaccinated. If you are a man who has sex with other men or are a transgender or gender diverse person who has sex with men and in the past 2 weeks have had sex with multiple partners or group sex, have had sex at a commercial sex venue, or have had sex at an event, venue, or an area where monkeypox transmission is occurring, then you should get vaccinated. You should be vaccinated within 4 days of exposure for the best chance at prevention. And you cannot receive the Jynneos vaccine if you've had an allergy to antibiotics to include gentamicin, ciprofloxacin, or if you're allergic to chicken or egg proteins. So what happens if you acquire monkeypox? So there are no specific monkeypox treatments available, but smallpox treatments that we used previously for smallpox are effective. So there's one called tecovirimat or TPOXX, and this is recommended for those who are more likely to get severely ill, like a transplant recipient or others with weakened immune systems. This is acquired from the CDC, so your transplant center would work with the CDC to get that. There's also the Vaccinia immune globulin intravenous, which can be used as post-exposure prophylaxis in a person with a weakened immune system for which vaccine is contraindicated. There's also a drug called cidofovir. We use this as a treatment of cytomegalovirus in transplant recipients. And we know it may have some efficacy against monkeypox, but it's not entirely known if it would be a useful agent as a treatment. And similar drug to cidofovir, brincidofovir, may also be effective against monkeypox. It's also not entirely known if it would be useful, and it's currently unavailable. So in summary, if you've been exposed or you think you may have been exposed to an infectious agent, seek medical attention and live life to the fullest, but use common sense and take the necessary precautions to protect yourself. And I think a quote that is very fitting for this talk is, "Prevention is better than cure." These are my references, and I thank you for your time and attention. You can email me if there are questions, but I will stop sharing my screen and we can go through some of the questions that have come up.
Wow, thank you for that. That was an outstanding presentation. I've got a couple of questions here that have popped up. How does mycophenolate impact our T cell response to COVID vaccines?
So mycophenolate, we know, does diminish the T cell response to COVID vaccines, to all vaccines in general, but in particular to COVID vaccines, it does diminish our response. And so that is why we do 4 total vaccine shots for solid organ transplant recipients. And now with the inclusion of the newest booster, it would be 5. And as more data comes out, we may find out that we may need to do additional booster doses of the newest booster that has come out. It's all a little unclear since this is all new information, but given that mycophenolate and our other transplant-associated medicines like tacrolimus, prednisone, et cetera, they all diminish our responses to the vaccine.
Okay, thank you. The next question was about food safety, and you had mentioned several different types of food that one might maybe shy away from. The question is really smoked lox, like for example, for bagels, like bagels and lox, is that something that one should stay away from, or is that considered to be relatively safe?
Yeah, so I personally recommend to avoid smoked lox. Smoked meats in general, as I mentioned, I think earlier, they just do not achieve a high enough temperature when being smoked in order to kill off all the bacteria. So you're at risk for still consuming something that can result in infection.
Next question, should a transplant recipient wear a mask or otherwise avoid being in close proximity to a lawn that's being actively mowed? So does mowing the lawn cause turf-based impurities to go airborne and be hazardous to a transplant recipient, perhaps?
So yeah, so I think if you are in close proximity to a lawn that is being actively mowed, it would be important to wear a mask. And that's largely because the grass blades actually do have mold spores on them that can be aerosolized as you're mowing. And if you breathe that in, you can develop a mold pneumonia or a fungal pneumonia as well. I would say that the person mowing the lawn, if that person is a transplant recipient, then they should most certainly wear a mask. If you're indoors, but with the windows open, it's possible that you don't necessarily need to wear a mask if you can avoid being right next to the window. So just keeping distance is sufficient, but if you're in the thick of it or you're very close to it while it's actively being mowed, it would be wise to wear a mask.
What does the data show about evo-shelled, hopefully I'm saying that right, efficacy, stumble over that word too, for 150 dose for patients in countries where they're only giving 150 over 150?
So we initially thought that a total dosage of 300, which is where this 150 dose would add up to, was effective. But we were finding that there were a lot of breakthrough infections happening on the 300 dose. And so that is why we upped it to 600 and included an additional 300 dosage for the people who only got 300 early on. So I would say that the 150 dose is probably the equivalent to getting a single 300 dose, which is less effective. It still does provide some protection, but it is a little less effective than getting a full 600 dose.
Next question, should kidney transplant patients have their SARS-CoV-2 semi-quant total antibodies checked after getting evo-shelled? If so, how long after receiving the vaccination shots?
Yeah, so, some centers do this and others do not. Personally, I do not feel that checking your antibody titers is too beneficial because we don't know an exact number where it would be best for you to be at. In other words, is 100 good? Is 75 good enough? Is 50 good enough? We just don't know. And so as a result, checking that value doesn't really tell us too much. We do know in general that transplant recipients don't respond as well to vaccines. And that's why we give as many doses as we give. And that's why we're also giving evu-shelled. But we also still, despite that, recommend that you practice all of these safety measures because we know that despite these efforts to protect you, they're just not sufficient as it is in the general population. So I don't see the purpose in checking an antibody level because it doesn't tell us much if we're going to be doing all these measures anyways. It doesn't tell us that you can back off on wearing a mask or anything like that. So I don't really see too much of a purpose outside of a research study of some sort to be checking antibody levels.
Would it be possible for a transplant patient to have less than 2,500 on their antibody report?
So it is possible. It's just not often seen. So, and as I was saying, we just don't know what number. The numbers I was using before were just examples, but we just don't know what number is going to be the best number to have if you're a transplant recipient. So it is possible, but it's not common to see.
Thank you. How soon after a transplant can one resume receiving vaccinations?
So most centers start roughly 4 to 6 months after you receive your transplanted organ. And they usually start, checking to see how you're doing with your graft before they decide. But generally speaking, 6 months after transplant is a very safe time point to begin receiving vaccines, and they do it very slowly over the next several months. So yeah, I would say 6 months is a good number to keep in mind.
Okay, thank you. What fruits or vegetables are not recommended to eat after a transplant, apart from pomegranate because of its interaction with the program? The fruits of the pomegranate family are better not to eat, such as I should say, should one avoid some of the pomegranate family fruits, such as oranges, passion fruits, melon, grapes, etc.? Is there anything that they should specifically avoid, or?
Yeah, so the one fruit that we generally tell people to avoid is grapefruit. And that is primarily because of its interaction with drugs such as tacrolimus. It can alter the levels of tacrolimus in your system and alter it in a way that's not good. So either increase it to a level that's unsafe or decrease it to a level that's unsafe. So generally, we recommend avoiding grapefruit. Other fruits, for the most part, can be safe, but it is always best to check with your transplant team because depending on the medication regimen you're receiving in particular, it may not be safe to consume other fruits. And that's very individualized based on the regimen that you're receiving.
Okay, thank you. You talked about avoiding unpasteurized juices, but if one makes juice at home with fresh fruit, should they also avoid that as well?
No, that's actually okay. It's, if you squeeze oranges to make orange juice, it's the equivalent of eating that orange. So it's not entirely unsafe to have fresh squeezed juice at home, but unpasteurized juices, for example, cold pressed juices that you can buy in the store, those tend to have a higher risk of infectious agents being transmitted to the person consuming it than if you were to just have fresh squeezed juice at home.
Is guacamole okay to eat?
Yes, guacamole is great and it's good to eat.
Okay. Next question. Has reduced immunosuppression prior to and a few weeks after a COVID-19 vaccination been shown to be effective in generating a better COVID antibody response?
So some centers will stop, for example, mycophenolate prior to receiving a vaccine. Not all centers have adopted that practice. And that's because the data is a little controversial. It's not clear cut that by decreasing or stopping any immunosuppression for a few weeks beforehand is going to significantly impact your antibody response. So not all centers do this.
Okay, thank you. What if a small amount of mold forms in the shower? Is that dangerous? Can the immunosuppressed person clean it, or should they reach out and have somebody else take care of it?
Yeah, so I would say any mold can be potentially dangerous, especially if you're a lung transplant recipient. So I would say that the immunosuppressed person should avoid cleaning it if it's at all possible and elicit the help of someone else to do it. And if you do have to clean it, then wearing gloves and an N95 or KN95 mask would be beneficial.
Okay. Do you consider it safe to eat indoors at restaurants as a recipient, considering the spread of COVID-19?
I would recommend to still eat outdoors if you're going to eat at a restaurant or avoid indoor eating at all possible because of the risks of COVID-19 and the fact that all the measures we take as, to protect our transplant recipients are just not 100% yet. They're not at a high enough level where it would be safe for people to remove their mask and be indoors around that many other people for an extended period of time.
Okay. Wow. Well, thank you very, very much for your presentation. It was incredibly informative. Our next sessions will begin at 11:45 Eastern time, and please check the event website or your email for Zoom, the Zoom link for your next session. And again, thank you, Doctor. We appreciate all of your time here, and we wish you the best of luck in your future endeavors. Thank you.
Thank you. Thank you for your time. I hope it was informative. So thank you.
Absolutely. Thank you.